Jamil Al-Jamil says GLP-1s cause all these issues, including pancreatitis, cancer, hair loss, osteoporosis, muscle mass loss, depression, thyroid issues, etc., etc. This is in regards to Serena Williams taking the medicine. She says, these miracle weight loss drugs come at a price, and goes through the list of all sorts of things. So let's just go through these one by one. Paralysis of the gastric system. The medicines do decrease your gastric emptying, but that wanes over time. There have been no studies reporting permanent paralysis, gastroparesis, from these medicines. There are case reports and lawsuits going on, but no actual evidence of this in any trials. In fact, there's been a meta-analysis of all the randomized controlled trials looking into this, and it hasn't been shown. Same with pancreatitis, not shown to be different from placebo. What about cancer? There have been a lot of studies looking at this, and overall it looks like, if anything, there's a reduced risk of most types of cancers, especially obesity-related cancers. What about hair loss? Hair loss does happen. You can see it right here in the trial under alopecia, that a small percentage of people do complain about it, and I have a lot of patients that say the same thing. The hair loss is likely from something called telogen effluvium. It's a stress-like response, and your hair tends to grow back once you're done losing weight. What about osteoporosis? Osteoporosis is absolutely a concern, especially with all the weight loss and if you're not lifting weights. But there may be some evidence that actually the medicines improve bone mineral density. So we'll see when larger, longer trials come out, but I'm not too concerned. Severe malnutrition, of course, a concern if people aren't eating enough. So this is why you should have dietitians and people that are helping you eat enough if taking the medicines. I don't necessarily disagree with that, but it can be completely minimized. I don't know how many times I have to address the muscle mass loss thing. It's not any different than if you're getting bariatric surgery or just dieting without exercise and eating extra protein. It's the same. There's nothing different about this. What about depression and suicide? Again, big meta-analyses, lots of data here. Doesn't seem to be a signal right there when you put it all together. In terms of depression in the data, it looks like there might be a decrease in depression when taking these medicines. Now, I see not depression, but anhedonia, where you just don't really feel motivated to do anything, kind of just, don't really want to get off the couch, don't really want to do the hobbies and stuff. So we should monitor mood. I've talked about the thyroid issues so many times. There's no issues with hyper or hypothyroidism. There's a potential risk seen in rodents for something called medullary thyroid cancer due to the GLP-1 receptors on their little thyroids. Humans don't readily have them, so not really seen in humans. She does mention gaining the weight back when you stop them, which is very well likely, and talking about how you should have a dedicated team helping you through this. I have dietitians, strength coaches, now a psychologist, dedicated doctors monitoring people very closely. So I do agree we shouldn't just be taking these without any actual care involved. Skip the compounded places, skip the great market, get good care.